Thank you, Sue. I'm just absolutely thrilled to be talking to all of you today about this topic. And I'll tell you a little bit about myself here in a few minutes. So I guess let's just go ahead and get started. So first, I do want to make a quick note about language. Today, when I'm referring to women in this presentation, I am talking about people that were born with ovaries. Most of the research around just human sexuality in general is done on cisgender and women, and mostly people that are in heterosexual relationships. So I'm not leaving out a population on purpose. It truly is just that much of the research is done on this population. More research is absolutely needed in our queer and transgender population. So let's just briefly go over the objectives for tonight. I'm going to talk about the prevalence and the complexity of women's sexual dysfunction, specifically low sexual desire. I'm going to identify the factors that most commonly contribute to low sexual desire. And then I'm also going to talk about some medications that we use sometimes for treatment. And I'll spend quite a bit of time talking about other treatment options. So let me first just tell you a little bit about me. I am a women's health nurse practitioner. I work mostly in gynecology practice. I work at Baystate OB/GYN in Springfield. I have been drawn to sexual health work since I was in nursing school. I took a human sexuality class my senior year and really just was immediately drawn to this. I spent some time working in a low-income family planning clinic, and I really saw how poor sexual health education just makes a long-term and long-lasting poor effects on women specifically. And I just really wanted to do something to make a difference in this field. So I've been working, like I said, as a women's health nurse practitioner now for, I'm on my 8th year now. And I've been doing a lot of extra education in sexual health, but specifically women's sexual health. And I'm now, in the last 2 years, I've been working on my certification as a sexual health counselor and educator. And just in a few months, I will be able to be done with that and submit my application. So I will officially be certified by ASECT, which is the American Association of Sexual Educators, Counselors, and Therapists. And I'll be able to be officially certified, which I'm really excited about. So first, I really want to applaud every single one of you for being here. Whether you're struggling with low desire yourself, or you're here because your partner is really struggling with low sexual desire, or you're just really curious about sexual desire in general, I think it's amazing that you're here. This is a really tough topic for a lot of people to talk about, whether it's because it's uncomfortable for them or it's just very frustrating. So I'm really, really happy you're here. And like Sue said, please ask questions. I'm happy to answer them today. And you can just put them in the Q&A box and I will answer them at the end of today. I'm going to try to leave us plenty of time to address questions. So let's talk about women's sexual dysfunction. Well, what is it? So women's sexual dysfunction can include either decreased physical or subjective, like how our brain feels about it. So decreased arousal. It can include difficulty with orgasm. It can include pain with any sort of sexual activity, and also low desire. Today, we're mostly focusing on low desire. The thing I think that is most important for all of you to take away from this today is that this is incredibly common and very normal. I don't want anyone to feel like low desire or low sexual dysfunction in general is abnormal, it may be a sign we need to do something, but it's very common. The studies are just all over the place on women's sexual dysfunction, to be honest. We really don't know the prevalence of it. I guess that's probably because people just don't like to talk about it. But also, there's just not a lot of studies that have been done on women specifically in sexual dysfunction. We see a lot of studies done mostly on males, unfortunately. So, I'm hoping we're going to have some more data on this. But as of right now, I mean, literally studies are showing from 7 to 70% of women complain of low sexual desire. My guess is that it's probably average around somewhere between 40 and 50% have this complaint. We see it most commonly in the ages of 45 to 64, and it's highest typically in the first year postpartum, during perimenopause, and also immediately post-menopause. Now, hypoactive sexual desire disorder, or HSDD, is the persistent or recurrent absence of sexual fantasies, thoughts, or desire for sexual activity that leads to personal distress. So this is for somebody that has had a persistent trouble with desire, sometimes we will use this diagnosis for them. I think this is a time that's really important for me to mention that absence of desire that is not distressing to you is not a problem. That's really not something we need to address. I've actually had patients say to me that they don't have any desire and they really think something's wrong with them. And then I ask them if it's bothersome to them or their partner, and they say no. And I say, well, then this isn't a problem. It's quite normal if you don't have desire, and if it's not bothersome to you, we don't need to do anything about it. I think our culture has something to do with this. Like, we've created this expectation that couples should be having like this much sex. And if they're not, then there's something wrong with them. But that really couldn't be any further from the truth. So why is sexual desire so complex? And let me tell you, it truly is. I've had a lot of women very frustrated say to me, why can't we just make this happen? Like, isn't there just a pill I can take for this? And unfortunately, it's just way more complex than that. So let's first talk about what the different types of desire are. So most men, about 75% of men, have what's called spontaneous sexual desire, or the interest in sex with little to no stimulation. So right here, you're going to see on the screen, I have this model that shows one of our first models of sexual response. And it has really just 3 phases here. There's desire, there's excitement, and then there's orgasm. So really, there's desire as the entry point, and then orgasm as the only ending point, as if everybody can and always wants to even have an orgasm. And so this is spontaneous desire. Very little stimulation needed to go from 0 to interested to go into this cycle here. And so although not all men have spontaneous desire, many do, and very few women do, 15%. So this is a really good example of what I call desire discrepancy, where one person in the relationship has a very high desire and the other person in the relationship might have a very low desire. But really, it's not low. It's just they have different types of desire, and I'll get to that in a bit. So another part of this, or another kind of sexual desire, is what's called responsive desire. And this is the other 85% of women experience what is called responsive sexual desire. I really like how responsive desire is illustrated in this model. And this was developed by a Dr. Rosemary Basson. So basically, most women start a sexual encounter in a very neutral state. So I always kind of say somewhere around here between like willingness to be receptive like right around this area. So if they have some sort of sexual stimuli with their appropriate context, which we're going to talk a whole lot about, then they might be able to process that in a way that causes them to have some sort of arousal. And that arousal in the appropriate context and environment may then turn into responsive desire. So for most women, arousal actually happens before sexual desire does, which I think is backwards of what most people assume happens. And this is important because if we know that arousal happens first, we can kind of key into that a little bit and kind of focus on, so what are the things that we can focus on to maybe understand like our arousal a little bit better. So anyway, let's continue with the cycle. So we have a sexually satisfying event, or whether that's emotionally or physically satisfying. This does not have to end in orgasm at all. And then that can then lead to sexual motivation, or like your why. That's what I like to call this. So for example, if this was a positive encounter that made you really feel much closer to your partner emotionally after the sexual encounter, then that may give you future motivation for a future sexual encounter. Like, this made me feel really good, so I'm more willing and receptive for another encounter. This actually can also explain why people that have negative sexual encounters, such as pain with intercourse, can actually have very little desire because they have no motivation. I mean, their motivation is, I don't want to have sex because it's not going to feel very good. So, why do we want to do something that hurts? You don't have motivation to do that. So an important part of this, like I said earlier, is of this like sexual response cycle is context. So context is very important because this refers to our external circumstances, our environment, as well as our brain state. So how are we feeling and what's going on around us, as well as how is our brain feeling and what's going on in here. It's really important to talk about context, because without the right context, we're very unlikely to be receptive to sexual stimuli that will then lead to arousal, then in turn will lead to sexual desire. So responsive desire truly does depend on our context. So I like to give some examples so you can kind of understand what context is. So one example, a woman is in a very calm state, relaxed, maybe lying on the couch, reading a really good book. Her partner comes up to her, gives her a little stroke on the arm, maybe a little hug, a kiss on the neck maybe, and she thinks, that feels really good. Her brain isn't very noisy because she's very relaxed, and she's able to process this and think about and become like receptive to the stimuli, and then might become a little aroused. And then she may have this now responsive desire to the touch that her partner gave her. So another example is a woman that just got home from work. She's cleaning, the kitchen, trying to get her kids to finish the homework. And she still knows that she has work she needs to finish up before she goes to bed that night. Her husband comes up and rubs her on the back, kisses her neck, and she pushes him away because she's just not in this receptive state for any sort of arousal right now. I really like to explain this as there is just too much noise going on in my brain right now. Like, are you serious? My brain is just processing way too many things right now to be able to respond to any sort of sexual stimuli right now. So both of these examples can explain how context affects our desire. It's so important because I really think that from what I've learned in working with patients is that it really is a high primary cause of low desire, is what's going on in our brain, what's going on in our environment. So basically, our brain processes information as it's coming in, and then it prioritizes this information. Like, do I need to deal with this now, or do I need to deal with this later? So when there are way too many stressors that are coming in that deserve our attention, that are high priority, sex just kind of falls in the lower priority, and it gets put on the back burner. We don't need sex to live. It feels good and it's nice, but we don't need it to function and live every day. But we do need food, we need sleep, we need shelter, and our brain knows that. It's all about priorities. So let's talk a little bit about how our brain makes these decisions. So like I said, there's this area of our brain that controls the inputs and outputs. And when it comes to sexual response, there's this specific area that kind of controls the how and when we have a sexual response. I really like comparing this to a motor in a car, because we have, if I can give you like the example of, you have an accelerator and you have a brake. So the accelerator is our sexual excitement, our motivation, our why. The brakes are our sexual inhibition, or the turnoffs, the things that are like really, putting down our mood right now. So according to this, we have a sexual arousal for women when we have activation of our accelerator and when we deactivate our brakes. So, so how I can explain this is, if you have like bricks of things sitting on your brakes, there is no amount of pushing on that accelerator that you can do to make the car go. It is also incredibly common that women are very sensitive to their brakes, or all the, inhibitors. And men are typically very sensitive to their accelerators. So once again, here's another discrepancy in a heterosexual couple, where, women have very sensitive brakes and are very easily, it's harder for them to release things off the brakes, where it's not that difficult for men typically. So what are the accelerators and brakes? Well, first of all, it's different for everybody. And what could be an accelerator for one person could actually be a brake for another, and vice versa. I was talking to one friend about this, and she said, stress, I have found that stress actually can be an accelerator and a brake for me. So even the same stimuli can be both things, just different types of stress for her, is kind of how she explained that to me. So this really can differ across. I think what's important is understanding what is for you. So what are the common brakes? I mean, this list could go on and on. I really wrote out the things I see most commonly. The research really shows us that the most common causes of low sexual desire are stress, depression, anxiety, trauma, and relationship trouble. So in other words, how your body and your mind are feeling, or your context, like I was talking about. So some important things I want to point out here in this list. One of them is medications. So a couple of medications can really affect sexual desire. The most common is what we call SSRIs, which are mostly used for anxiety and depression. So things like escitalopram, Prozac, Lexapro, those are just the ones off the top of my head, Zoloft. So those medications actually can lower sexual desire, because how it affects the, not hormones, but how it affects like dopamine and serotonin in our brain. And then some birth control actually can affect sexual desire. So those are some things maybe to think about if you've noticed a significant drop in your libido since starting a medication. That may be worth addressing with the person that prescribed it for you. Poor overall health. So people with chronic medical conditions, I do find that can be a cause for low desire as well, mostly because you just don't feel good, fatigued. Also, how are you just feeling about yourself and about your body in general? Because low self-esteem, also on this list, is a huge cause of low sexual desire. One more thing I do want to point out on the list too is pain with intercourse. So I'll address this again in a few slides, but so many women struggle with painful intercourse or any sort of penetration. And so if you are not having sex that feels okay even, you are very unlikely to want to have that kind of sex. So if you are having pain with intercourse, I strongly recommend that you talk with your gynecologist because I do think it's something that needs to be taken seriously. It could be something that we just need to get you on a couple medications or give you some exercises to do. But there are a lot of things that can, like a lot of medical conditions that can lead to painful intercourse. So I think it's worth addressing, absolutely. So I also get the question from a lot of women of, so I have no sexual desire. Can you check my hormones, please? So hormones absolutely will affect your sexual desire, but it is not just your hormones. Like I said earlier, the most common times that we hear women complaining of low sexual desire is during the menopausal transition or right after menopause or immediately postpartum. And during all of those times, our estradiol levels are fluctuating and are very low. And that can make you feel fatigue. You can be having hot flashes. Your periods can be very erratic. You can feel very moody. You can have vaginal symptoms like vaginal dryness and lots of other changes. A lot of women do not sleep well during this time and are just tired and fatigued constantly. So if you're feeling those things, it is most likely that those are the things that are causing your low libido, not your actual hormones. So, we use things like hormone therapy, but that's not the only treatment. There are a lot of other medications out there, herbal supplements. I have a couple of vitamins that I recommend routinely. There are just lifestyle changes that you can make if you're feeling these things. And if it's just postpartum, typically, things will get better, but still talk to your medical provider, because if you're breastfeeding for an extended period of time, then you are likely to still have some of those symptoms for a while. And I think it's definitely worth addressing. So I do want to address testosterone. So I have gotten the question quite a bit about testosterone, and if, can you check my testosterone because I'm not having a lot of desire? Well, that's a difficult question because high and low levels of testosterone for women aren't always correlated with a low or high sexual desire. There is and possibly can be a correlation, but so this is an example I'd like to get. So there is a syndrome called PCOS, which is polycystic ovarian syndrome. And most of the time, these women have very high levels of testosterone. I do not find that most of these women have very high sexual desire. So, and it usually is because they have a lot of other medical conditions or other parts of PCOS, specifically depression, that can affect their sexual desire. So basically what I'm saying is that high desire doesn't always equal high testosterone. So low desire doesn't always equal low testosterone. It can, but not always. So let's talk about the little pink pill. Unfortunately, there actually just isn't really one out there, because there's just nothing that's been proven to increase women's spontaneous desire. First, with so many other factors that can affect women's sexual desire, giving you a pill to just increase your arousal wouldn't really be helpful, especially if you're still struggling with a lot of pain with intercourse, or if you're still struggling with a lot of anxiety or depression. Second, there are some limited effects of these drugs that have been approved. But there are 2 drugs on the market that were FDA approved for the use for low sexual desire for women. So I'll go over them briefly. The first one is fulvestrant, and it's also known as Addyi. This was the first drug approved by the FDA for treatment of low sexual desire, and it's only used right now for premenopausal women. It's taken daily. It can have side effects that include dizziness and low blood pressure, and it should not be taken with alcohol. And then the next medication is bremelanotide, which I can never pronounce. I am so sorry. I'm just gonna tell you this. I practiced that stupid name like 18 times in the last couple of days, and I just cannot get it right. So I apologize for just killing that. Anyway, so the brand name of it is Vyleesi. So this is another medication that was approved for treatment of hypoactive sexual desire disorder. It's actually an injection that you take about 45 minutes before a sexual activity. It can have side effects that include increased blood pressure, and also some women experience nausea and vomiting with it. So really, neither of these medications were shown to be the miracle drug for women's sexual desire. They showed that about on average, women using the medicines had about one additional sexually satisfying event in a month. So for women that were having one event in a year, that's definitely an improvement. But it really is just for a select group of women that we're seeing that these medicines work. So testosterone is another medication that I will sometimes prescribe off-label for low desire. Like I was saying just before this, high testosterone doesn't equal high desire, so it won't absolutely work, but it can. It's not approved by the FDA, so we use it off-label, and it also has to be compounded in a specialty pharmacy. Bupropion, which is also known as Wellbutrin, is an antidepressant that also can be used off-label for low sexual desire. I've actually used this for a couple of my patients that have long-standing depression and also are having low sexual desire, because sometimes we can help with both things at once. I've also used bupropion in conjunction with people for people that are on SSRIs. So the people that are on the citalopram or the Zoloft, sometimes we can use bupropion in conjunction with that, because it'll mellow out that side effect if you are having that side effect with that medication. So if people are having painful intercourse or having vaginal dryness, vaginal estrogen can be very helpful treatment for that reason. Vaginal estrogen, by the way, is incredibly safe to use. It is not the same as oral or even the patch of estrogen. The side effects and risks are totally different with vaginal estrogen. And it actually, I think, really can be a life-changing medication for some people, especially for people that have pain with intercourse or a lot of dryness. Because like I said, if you're having pain, why do you want to do it? So, it really can be very helpful. Scream cream is something that can be used for people that have a difficulty with arousal or orgasm. It really helps to increase blood flow to the area. So that's another topical that can sometimes be compounded, but also can be bought over the counter, actually. There are some over the counter ones as well. So like I said, before we do any medication treatment, I would always recommend that we're trying to identify other possible causes. So if it's not medication, what can I do? Well, first, you really need to identify the breaks. What's going on in your environment? What's going on in your mind? What's in everyday life that might be decreasing your sexual desire? And then let's think about what your accelerators are. What's the sexual stimuli that you really need to increase maybe? Maybe you need to better understand what your body even responds well to. Maybe you need to explore your own sexuality a little bit more. You know, as we age, our body changes so much and our mind changes so much. Our sexuality also changes. So the things that worked for us when we were 18 usually don't work anymore when we're 35 even, 40, 50. So we really need to help identify, like, what is my body responding to now? Not what did it respond to 15 years ago. I also really think it's important, if you remember looking at that circular desire model that I was showing earlier, that we really think about what your motivation is. So what is the reason that your body would want to respond to any sort of sexual stimuli? What is the reason that you want to have any sort of sexual activity with your partner? But it doesn't even have to be with a partner. But what's your motivation? So is it because you feel closer to your partner? Is it because it just feels good? Is it because it's a great stress reliever for you? I think it's really important to identify what is the why for you. And although I do think it's really important for us to have relationships where we are compromising and doing things for the other person, your why shouldn't always just be because he wants to or because she wants to. I don't think that's the best motivation that will give you your why. It's not a bad reason, but I do think identifying your own motivation is a great idea. And then on this slide, I really just wanted to give you some ideas of some of the changes that can be made. So once you identify all of those breaks, now we can really get an idea, like, what are the things that I really need to focus on that can help to increase my desire a little bit. So I love mindfulness, and I will give you a book recommendation at the end. Mindfulness can be incredibly helpful for people that have had pain, but also can be very helpful for people. I have women all the time that just say to me, I'm just always so much in my head when we're having sex. Well, mindfulness can be the answer for that, honestly. Stress management, I'm going to talk about that here in a second. Treatment of any underlying mood disorders. So really, if it is anxiety or depression, maybe we really need to get a better hold on those things. Sensual touch is an amazing exercise that I like to give to couples that are struggling with intimacy overall, or just feeling like we're focused too much on just having orgasm and not really enjoying time together. So sensual touch is a great exercise that I like to give people. And then the mirror exercise, if you are struggling with low confidence, poor self-image, I do think that the mirror exercise is something. You Google it, honestly, I think you will even find, and I have a ton of resources for the mirror exercise, but I think it can be incredibly helpful to help change the narrative in your brain of, I am beautiful, and not of pointing out all the things that you don't like about your body. And then the other thing I want to point out is pelvic floor physical therapy, which if you are struggling with pain with intercourse, pelvic floor therapy can be incredibly helpful and life-changing, not only just for that reason, but definitely for that reason. So I spend a lot of time talking to women about stress management because I really think that in the end, this is one of the most common causes of low sexual desire for women. I find that women take on so many tasks and leave very little time for themselves at the end of the day. I don't even know how many people have told me they don't have time for exercise, they don't have time for self-care or rest, let alone sometimes to even go to the bathroom by themselves. So if I could give you, any piece of advice today, it's that I want you to prioritize yourself a bit better, because if you don't take care of yourself and your health to overall reduce your stress, you're never going to have the time and the energy to have sex. So I typically recommend scheduling 1 hour a week for self-care for yourself. I know that can sound like a lot for some people, but you need to use your village. Like, use the people around you. Ask your friends. Maybe you take the kid, you take the kids one day, they take the kids the next, just for an hour. And I want you to spend the hour doing something that you love, something that really makes you feel good, because taking that time for yourself is going to overall reduce your chronic stress. Now, I would definitely recommend taking more than an hour, but for some people, I understand that's a lot. So start with an hour and then increase as you need to. But really, giving yourself some time can be so helpful for overall stress. And, if you need more, maybe you need your partner to do a little bit more, take the kids a little more. You just need to communicate that you need those things from them. And I'm not ever saying that you're exchanging sex for your partner doing the dishes. This isn't an exchange service. That's not what I'm saying. But maybe if they can take some load off of you, your overall stress will be reduced. And then you're going to have a little bit more time and energy to maybe have some desire for sex. So communication with your partner is incredibly important if you are partnered. It's very interesting to me, but we actually find that most people say that the person they have the most trouble talking to about sex is the person that they are having sex with. I think it can be a difficult discussion, but I think it's worth it. If you're the lower desire partner in the relationship, or you're the person that has responsive sexual desire and you're still trying to learn this about yourself, it's really important to explain those things to your partner. Maybe sharing with them what you learned today. Maybe sharing with them what you are finding are your accelerators. What are your brakes? What are the things that you need more of, you need less of? It's really common in the course of a relationship that sexual practices will change, and that includes frequency. So you having sex less often is actually quite normal, and that's okay. But maybe you just need to talk to your partner about what's our compromise here. It's common that higher desire partners will feel a sense of rejection, or feel like, my partner doesn't love me anymore because they don't have the same kind of desire that I do. So I think it's important to talk about that. Ask your partner if that's something that they're feeling, because it's important for you guys to understand what you're feeling about this. And this isn't a time to play the blame game. This isn't the time to say, well, you're right and I'm wrong, because there is no right or wrong type of sexual desire. They're just very different. And it takes some time to understand what works for you, what works for your partner, and what can you do to, come together and figure out, like I said, a goal or a compromise on the amount of sex that you want to be having. Maybe you need to talk about daily tasks that could be divided a little bit more evenly for the both of you. Maybe if you're having pain with sex and you haven't talked to your partner about that yet, this is a really good time to talk about that, so you guys can talk about what the solution could be. Or maybe your partner goes with you to the doctor so that you can discuss that with them, and your partner can be there with you for support. So like I said, this, no desire is better than any other. This is really the time to work together so you guys can find a solution together and something that's going to benefit both of you and your relationship in the long run. So I really could go on and on and on about this. Any of my friends, I'm sure, my people close to me and my colleagues know that this is something I'm so passionate about. But I do want to leave any room for any questions today. If you've thought of anything, please put them in the Q&A box. I see a few there right now. But if you really take anything away from today, I want you to understand that you're not broken. There's not something wrong with you. This is incredibly common. And if you are struggling with low sexual desire, join millions of other women around the United States, let alone around the world, that are struggling with the same complaint. There is hope. There are things we can do for this. And this is likely just a phase of life that you might, need to do a little bit of work to just move past it. But I promise that there are some things we can do. So don't give up. I get that it can be very frustrating, but there is hope out there. And then I just lastly wanted to give you guys a couple of my favorite books for recommendations. So Come As You Are is the #1 recommended book that I will give you and most of my patients to start with that complain of low sexual desire. It's written by Emily Nagoski, which is actually a Massachusetts native, which is really cool. But it is a really in-depth book about desire in general and just women's sexuality and how our brains and our bodies work. So I think it's a great place to start. Better Sex Through Mindfulness is a fantastic book for anybody that is struggling with painful sex, anybody that has a history of trauma, and also for people that really struggle with getting out of their head during sex, or really feeling like they're in it. And then Becoming Orgasmic has been around for a very long time, and there's a couple of different editions, but it really is a fantastic book that can be helpful for people that are trying to understand their overall sexuality a little bit better, and really just get better in tune with their bodies in general. So I think that that's a great book as well. So I really thank everybody for being here today. There's a couple more questions now, so I'm so excited. I'm happy to answer anything.
Great talk, Kelly. Thank you. And I appreciate your passion for this talk too.
Thank you.
Really great information. And like you said, we do have a number of questions. So I'm going to just moderate them for you. But feel free to jump on if you feel like you would like to. The first one is, I've never had a high libido, now in menopause, but for about 3 months towards the end of perimenopause, my libido was really high, almost like a teenager, and I loved it. And now it's gone. Was this some kind of hormone dump? Would love to get that desire back. Have you ever heard of this spontaneous change in libido without factors changing?
That's a really good question, actually. I have heard of, now you put it the right way, actually. Is this some kind of hormone dump? I mean, it truly could have been. During perimenopause, it is a roller coaster. Our estradiol, our testosterone levels are up and down, up and down. Our sleep is changing constantly. Our energy levels can be very different. So it really could have just been related to how your body was feeling in general, but it absolutely could have been related to those hormones that were just fluctuating so much. And you had a couple weeks maybe where your testosterone was very high. So I do hear, though, that women in perimenopause can go through these kind of up and downs. So it's not anything that's incredibly abnormal.
Excellent. Thank you. The next question And they're wondering if you know if the cost of Addie has gotten any less. This was prescribed years ago, but was very expensive. And they'd never tried it, and studies were not convincing to them.
Yeah, so I think that Addie is now being covered by a few more insurances, but the out-of-pocket cost I don't believe is any less expensive. I honestly have only prescribed this medication once, so I have very little of my own anecdotal data about how well this medication works. I do have a few colleagues and people in conferences that have said that they've had some good response with it. But like I was saying in the presentation, I really do think we need to try to address some other factors first, because I'm like you, the person that asked the question, like I'm really not convinced with the studies either. So I'm not really sure. Unfortunately, there just isn't that miracle pill yet.
Excellent. Thank you. The next question, any tips for compartmentalizing thoughts so you may be more receptive to sex? And then the second part of that question is vaginal estrogen an oral medication?
So mindfulness, 100%. If compartmentalizing thoughts is something you are struggling with, I really do think that getting that book or looking into mindfulness practice at all, it would be incredibly helpful for you, because we really do need to learn how to shut off part of our brain and focus on what we want to focus on. So if it's you want to focus on sex and what's going on right now, then you need to be able to learn how to shut off the thoughts so you can focus on what's happening in my body. What are things feeling like? So yes, absolutely. That is my biggest tip. You need to look into mindfulness. Vaginal estrogen is a vaginal medication. So it comes in a cream. It comes in a tablet that is inserted into the vagina. It comes in a suppository-like form that's more of like a waxy kind of substance. Sometimes we have to compound it at the pharmacy, at certain like specialty pharmacies as well. It comes in lots of different ways, but it's not taken orally.
Thank you. The next question, will this talk be available to rewatch? And yes, it will be on youtube.com/Baystate Health. And we will send the link. It's usually available a couple of days after the event. So you can certainly email me if you'd like that link, but it will be available on YouTube.
Great.
The next question, where do I find the sensual touch and how do you bring it up with your partner?
That is a great question. So sensual touch, there's a lot of different resources out there for it. I think a great place to start is Cornell Health. And they have a really good PDF of that just on their website. You can literally type in sensual touch in Cornell, and it will come up. It's called Sensate Focus. I like saying sensual touch, but the actual practice is Sensate Focus. And how to bring it up to your partner. Well, without knowing your relationship dynamics, I would say the best way is to tell your partner that you are feeling like you are lacking a bit of physical intimacy, or that you feel like you are not understanding what feels good for you anymore, and you want to spend some time with them exploring what sensations might feel good for the two of us, because that's really what Sensate Focus, sensual touch is all about. And there truly is never, like I said, people have the hardest time talking to people they have sex with, like about sex, which is wild to me, but it makes sense at the same time. It's a difficult subject. So I think that just being very upfront and honest is the best way to go, and saying that I need this from you, not that you did anything wrong. Like, I need this from you because I'm feeling a lack of intimacy. And so what can we do together? And this is something I think that we could do together to help build that. That's how you might go about it.
That sounds terrific. It does sound like a really good idea. The next question, the creams that you talked about with no side effects to help with orgasm. If you have a healthy libido, can this make sex and orgasm even more enjoyable?
So let's see. Oh, so screen cream. So actually, yes, it could. I would just be very cautious with too much screen cream because it, like I said, it can help to bring a lot of blood flow to the genital area, specifically the clitoris, if you're using in that area. And actually, overstimulation of the area can sometimes be uncomfortable and painful. So I would go very slowly with that if you're using it when, just as like an additive. I think a lot of people actually can do that, and it could be very helpful and make your orgasm much better. But I would just go very slowly with it and be careful.
I was on mute. Next question. I'm very curious to hear you mention testosterone, but no mention of estrogen. My understanding is that testosterone level in women versus men is so much lower. Any comments on this?
Absolutely. So yes, women's testosterone is about a tenth, if not less, of a men's normal level, whatever that is. And it can vary across our lifetimes from just as all the rest of our hormones do, from the ages of 18 up to 65. Like an 18-year-old's testosterone would be much higher typically than a 65-year-old woman's testosterone. And the reason I mentioned testosterone is because that's typically the hormone that affects desire more than estrogen does. But estrogen and testosterone do kind of work together, and as one increases, the other can kind of follow, and they absolutely do have a relationship. But high or low estrogen isn't necessarily correlated with desire as much as what I would say testosterone would be. Although remember that I did say high testosterone doesn't always mean high desire. So, it can be kind of tricky, and it's so different for every single person.
Thank you. I guess this is sort of related to your talk, but this person is just wondering how do they know what phase of menopause that they're in?
So I think the phases of menopause get confusing because there's a lot of verbiage out there. So I will clarify very quickly. Menopause is when you have not had a period for 12 months. Unless you're on some sort of medicine, and then it gets kind of tricky, like if you're on birth control. But menopause truly is when you have not had a period for 12 months. Anytime after that is postmenopause. Anytime before that really is perimenopause, when you're having menopausal symptoms like hot flashes, night sweats, mood swings, fatigue. That's when, that's the perimenopausal. There is no like start, middle, and there is an end, but there's no way to know where exactly you are. It's incredibly frustrating, and I totally understand that.
Totally. Thank you. You touched on this already, but I want to reconfirm that vaginal estrogen cream is safe to use. I'm super dry since menopause in my OBGYN, and highly suggest I use this. But I've heard estrogen cause negative health issues. Sex for me is non-existent due to the excruciating pain.
I'm so happy you asked this because I wanted to talk more about estrogen anyway, but I didn't want to get too deep into it. So quickly, I'll try to answer this as best I can. So vaginal estrogen absorbs through the vaginal tissue at a much lower rate as it would if we take it by mouth or if you put a patch on your skin. So for people, the one that everybody talks about usually is breast cancer. People are concerned about hormone therapy and specifically estrogen and the risk of breast cancer. There has been 0 studies related to vaginal estrogen and any sort of breast cancer. There are actually very few contraindications or reasons that we can absolutely not use vaginal estrogen. So it is incredibly safe to use. I obviously, if your OBGYN highly suggested you use it, you don't have any of the contraindications. So I would highly recommend that you try to use it. Most women using it have a significant change in the vaginal tissue, and really it can be just absolutely life-changing for a lot of people. So I definitely would recommend using it. It is very safe. Do not pay attention to the boxed warning. I never say this, but with vaginal estrogen, I will say this. Don't pay attention to the box warning. They have to put that warning on there for every type of estrogen. It's not the same of application for vaginal estrogen. So I want you to pay attention to box warnings. Sorry, but just not for the vaginal estrogen with breast cancer. It is no risk. There is no study that has shown that.
Very good. That's good to hear. We're getting close to time. I think we only have time for one more question, but I thought this would be a good question to end with. Is there any benefit to masturbation, and would that help increase sexual desires and drive?
That is a great question. So I think that there is great benefit to masturbation, and the book Becoming Orgasmic is something very specifically that I would say, if that's something you're struggling with, that book could be very helpful, because she truly leads you through some exercises so that you can help to understand what works well for your body. So I think that there is great benefit to masturbation. It can be helpful for sleep. It can be helpful for stress relief. But most importantly, it can be helpful to kind of just feel more at one and like with your body and yourself and your mind, and to become more comfortable with yourself. I do think that in the end, it can help to increase sexual desire, because if you know what feels good and you know what benefits you get from having some sexual stimuli and things that feel good, and you know how that benefits your body and your mind, that can actually be that motivation that you need maybe to be more receptive to sexual stimuli in the future. So I would refer you to that book, Becoming Orgasmic. There is another book called Sex for One. That is also a fantastic book. I have like 100 books that I could probably recommend. It's really tough. But I would say the Becoming Orgasmic book would probably be the best one for you to start with.
Does it include information about sex toys for women in those books?
It absolutely, both of those books does. Absolutely.
Okay, very good.
Yes. And then really quick, I just want to address, I see somebody asked a question about referring patients to me. So I am working at Baystate OB/GYN. I am taking new patients for sexual health related counseling. And you can just send them to the office to make a new patient appointment with me. That shouldn't be a problem.
It's part of the survey that if they'd like to make an appointment, they can include that information, and we'll get that over to your office, Kelly.
Great. Thank you.
So thank you, Kelly, for this excellent talk. Really helpful. And thank you to our audience for joining us and for providing those great questions. Really terrific. Thank you so much.
Yes. Thank you, everybody. Have a nice evening.